Hello and welcome to our discussion on the Ochsner's Back and Spine Center. This is a project that we've been working on over the past several months. I'm joined with two of my colleagues here with Dr. Erin from our Physical Medicine and Rehabilitation Department, along with Dr. Justin Haydel within our Neurosurgery Department. And I'm Dr. Brandon Hicks. I'm one of the interventional pain management specialists, and we're all here at Ochsner Baton Rouge. So like I said, we're here to discuss the new and improved Back and Spine Center of Ochsner. This is new, completely new to Baton Rouge, but this is a program that's been going on within the Ochsner system for several years now. And we recently made some improvements and we wanted to share what we have to offer within this program. So we're going to go over a couple of different things today in regards to how we treat back and spine pain. So the purpose of the Back and Spine Center is that we're trying to bring a more collaborative approach to treating chronic back and spine pain. We're trying to avoid the fragmented care that can occur, as there's a lot of different healthcare providers that you may see along the pathway to help treat these conditions. So we want to bring a multidisciplinary approach and treat these conditions from all fronts. So what we are going to mainly utilize is what's called a patient navigator. And what this navigator can do is help guide the patient to the appropriate discipline to help address their needs at the time of wherever they are in their course of pain. So we can go ahead and get started. I want to just discuss what are some of the more common things that we see that cause back pain. So Dr. Derbigny, what would you say are some of the more common things that you see on a daily basis when it comes to back pain?
So in my practice, I see a lot of more neck, upper back pain issues. So 90% of these patients are going to be more of a muscular cause, where it's muscle tension or chronic myofascial pain is the official term. So this is usually related to posture, stress, tension, a few different causes. Some people do have underlying spine changes in their cervical spine, but a lot of times these patients have pain related to their muscle tension. A lot of people are working at desk a lot now. So we're working on ergonomics. We're working on strengthening the muscles, working on posture, stretching, physical therapy. Those are all ways to treat these neck and shoulder tension issues. Some of the lower back issues that I see are related to arthritic change or degenerative changes in their low back, where these people come in with achy low back pain. It can go into their legs. So in my approach, we do more conservative things where I will evaluate a patient, we'll figure out what the diagnosis is, and then the next step is going to be to do physical therapy, which is the most conservative step in the process. So with physical therapy, we can focus on strengthening up your core, strengthening up your hip muscles, calming down any other areas that might be inflamed. And if that works, it's great. But if not, the next step would be to see, say, an interventional pain management provider like Dr. Hicks, or if there's something else significantly concerning, the patient would be referred on to a neurosurgeon or ortho spine surgeon like Dr. Haydel.
That's great. Yes. And I see a lot of those same complaints in my clinic within interventional pain. And we always want to start off with the more conservative treatment. So there's many different causes to neck and back pain. It can be something as simple as the muscle tension. It can be something a little bit more complex, such as a disc bulge or a protrusion or any different disc issue that may arise. And that in turn may irritate a nerve and send a shock wave of pain down into your arm or your leg or anywhere throughout your body. And I do see a lot of arthritic pain as well of the spine. And arthritis is a naturally occurring disease process as we age, but there are a lot of different things that we can do to help treat that and also try to help prevent any further progression of the arthritis. So there are many different causes of back pain and neck pain. And the goal of what we're trying to do within our clinics is trying to decipher which cause is your likely culprit. or at least the primary culprit in your pain. What are some causes that you typically see in your clinic, Dr. Haydel?
When I'm in a clinic setting, it's more of the degenerative type things. And that's the whole goal of this program, is to navigate everybody in a proper fashion and to try these conservative measures first. So a very typical thing that I see on a daily basis is a lumbar herniated disc. Very common. There are a lot of people that have disc bulges, quote unquote, or disc degeneration. Most of the time, we're able to manage these things conservatively. We're able to do physical therapy in these injections, and we're able to get temporary relief. And a lot of times these problems can resolve on their own. So I'm sort of the last step in the whole process. And as a surgeon, I'm looking for something structural, compressing a nerve, whether that be a bone, whether that be alignment being off, or anything structural that I might be able to do to help the patient and physically take whatever's pressing on a nerve and take that off. Most of the time, I'm seeing patients for even sometimes 6-8 weeks after these problems have occurred. Things that would lead me to see something more acutely are, after things like trauma and those types of settings, or if somebody develops an acute weakness in a leg or an acute pain that's 10 out of 10 causing them not to be able to walk, pain which is so acute that's lending themselves having a need to go to the ER. And in those types of situations, sometimes a surgeon's consultation is more appropriate on an acute phase. But most of the time I'm seeing these degenerative problems that have been worked up by our other secondary teams. Lumbar spine is probably one of the more common, and also we treat a wide variety of cervical or neck pain problems, people with chronic middle back, lower back, and upper neck problems are a high percentage of the consultations that I see in my office. We're also able to treat larger problems such as scoliosis and people that have chronic deformities, whether that be from osteoporosis or things like compression fractures from osteoporosis. So we have a number of tools in our bag to be able to treat these things surgically, but obviously the goal of all of this is to treat you and our patients in the most conservative management possible, and also to find the most minimal surgery that we're able to do to get our patients back to being well, back to 100%.
Definitely. Yeah, and lower back pain affects 2/3 of adults at some point in their lives. It's actually one of the probably top 3 reasons to go see a medical provider. And this can be a scary time in their lives. And there is a difference between acute and chronic pain, just like Dr. Haydel was alluding to. So acute pain tends to be something that's fresh, new. You can likely identify some cause at the time of the event. And then chronic pain it's something that's been lingering on for a while, usually of at least 3 months duration, and more often longer than that. And I guess the next question is when should a patient seek medical care for these conditions? Should they address this more early on? Should they wait and try some more home remedies or self-treatments? What do you tend to recommend for those cases, Dr. Derbigny?
So if in the setting of its acuity, and like Dr. Haydel said earlier, where if it's 10 out of 10 and they're unable to walk and really get around, that's when you want to seek emergent care, or you want to go in and get in earlier. If it's something that's been bothering you for a few weeks, off and on, it's not consistent. Yeah, you want to try your ice. You want to try your over-the-counter anti-inflammatories. You can do certain stretches that are not causing or increasing the pain. You can talk to your primary care provider, send them a message and ask, should I get into physical therapy, or should I keep doing these certain stretches, exercises at home? But if it gets to the point where it's 10 out of 10, you're limited, you have weakness, and you're really not able to function and carry on your normal activities of daily living, that's when you definitely want to call and get in and be seen.
Definitely. I completely agree with that. So if your pain starts to become debilitating to the point where it's limiting your functional daily activity, whether it's self-care tasks, work activities, whatever it may be. If you're having this pain become a barrier to your function, that is when you need to seek medical care. So to interventional pain, if it's more of an acute pain and you're having a typical type of sciatica that's shooting down the leg, or if you have a pain in the neck that's shooting down the arm, you may be able to come see me or one of my colleagues in the interventional pain management department to help address that severe acute pain that's radiating down. And then we can do things like epidurals or anything that can help address that source of the pain. So whenever this pain is becoming debilitating, that's when you want to seek medical care. I couldn't agree more with that. And just like what Dr. Derbigny and Dr. Haydel were saying, you want to start with the more conservative treatments first and foremost. So I guess, when should a patient come seek medical care from you, Dr. Haydel, or would you typically rely more on a referral from the primary care provider or one of your other specialties in the same discipline?
Yeah, from a primary care standpoint, I think the red flags are common things like foot drop, where a patient acutely has a change in their strength, and they're having trouble with walking. That certainly is a red flag. A patient with a history of osteoporosis with an acute onset of back pain, that's, again, 10 out of 10. You want to get x-rays and make sure they don't have a compression fracture or something like that. Other things are things like if a patient has red flag signs such as urinary retention, difficulty with grip, and having multiple falls. Those are all kind of the red flags that lend you to want to order imaging early, get plugged into the system early. If you're not sure, I think it's always best to send out a referral to at least have somebody that's more familiar with these types of things, at least make that determination as to whether to go or which direction to head the patient off in. And I think, again, that lends into this back and spine center that we're trying to, we are creating, is that we give our primary care providers and our patient population the option to simply press a button. Hey, I don't know. You can go on our app where we have making it very easy to schedule these appointments. And we have these navigators that we're going to be dedicated just to this project. And we have educated them on these red flag signs. So if you're not sure, it's always best to send off a referral or even book an appointment yourself. You'll be contacted with a navigator who has expertise in this, and we can sort of help both our patients and our primary referring providers on how to take that next step to get our patients where they need to go.
Definitely. That's the main purpose of having this patient navigator, so they can get the patient into the right location to address that need at that specific time. So with all what's in the back and spine center, the front line is to be evaluated, or at least have questions answered by the patient from the navigator, so we can determine where the patient would best be suited. So within that, the three main disciplines we have are Dr. Derbigny is in physical medicine and rehabilitation. Myself, I'm an interventional pain management, and Dr. Haydel is a neurosurgeon. So these are the three main disciplines that go into it, but there are also a lot of ancillary services that go along with it as well, such as physical therapy, where we have many different subsections of that, such as the Healthy Back program, which has been doing very well for a lot of our patients. We also have nutritional and dietary services that can be of assistance as well, and a lot of other things that are going to be beneficial in treating the whole condition from not just one avenue. So I guess in your practice, Dr. Derbigny, what are the typical treatments that you would prescribe for most of your patients?
So depending on the etiology of the problem, so if it is a degenerative or arthritic issue, so I will definitely figure out exactly, where's where is it coming from? And then physical therapy is always going to be the first line of defense for me, because I'm the most conservative on the approach, where we're going to focus on what can we address to stabilize and strengthen around that arthritic change. There are certain peripheral injections we can do in clinic. There are trigger point injections that we can do for muscles. Those are going to be the first line of defense on my aspect. In regards to the Healthy Back program, it's a subset of physical therapy where this is dedicated to people who've had chronic neck or back pain, to where at our O'Neill Physical Therapy campus, they have 20 physical therapy sessions dedicated, focusing on range of motion, strengthening overall well-being. And they have a health coach that works with them for a continuation of almost 6 months, where they have almost a year of care to really try and improve their chronic neck and back pain to the best of their ability, without having to do surgery, without having to do injections. Or if they do need injections along the way, they can pause, go and do injections to calm something down, come back and re-enter the program, and continue on working on their strengthening and their range of motion. So that's a subset of therapy where it's a separate program, but regular therapy can, encompass the neck, the back, any soft tissue things that are going on. So a lot of good conservative options, as well as dietary changes, weight loss changes. Those are all addressed in my clinic.
Okay, great. Yes. Yeah, with you being the most conservative approach, I'm probably the middleman in between with interventional pain management. So what we tend to do in our practice is that we will identify the root cause, or at least the primary cause of the pain, and focus our interventional treatments on that. We also will utilize different medications, both opioid and non-opioid, depending on the circumstances and seeing what is best appropriate for the patients. But we try to focus more on these interventional methods, and that can be anything from a simple epidural, either in the lumbar spine, cervical spine, or in the thoracic spine in some instances. And we identify if you have a problem area that's usually due to a disc bulge, or if you have any reason to have narrowing around the canal that the nerve exits of the spine. And sometimes that can cause a debilitating pain down the arm or the leg. And we can address that with a simple epidural and see if that can help address that acute on chronic pain, whichever is bothering you at that time. And we treat a lot of different arthritic conditions, like I was talking about earlier. We use a lot of x-ray guidance for most of our procedures, just because these joints on these levels are very small and we can pinpoint where we're going with the needle. So I'm not making any incisions or anything like that when I'm doing my procedures, or most of my procedures. But when it comes to this arthritic pain, there's a specific nerve that we can target to eliminate the body's ability to feel the pain from the arthritis. So, and what we do is a test block first. And if that test works very well for you, then we can go back and do what's termed an ablation, or what I like to call a burning of the nerve. And that eliminates your body's ability to interpret the pain stemming from the arthritic joint. And we can do that both in the cervical spine, lumbar spine, and also the thoracic spine. And there's many other different procedures that we can do for spinal pain. It is a very common syndrome called sacroiliac joint dysfunction, and we can inject that joint. We can perform ablation to that joint as well. And we can also even fuse that joint at times if it's a problem area that's not really responding well to the more conservative treatments. And there's lots of different things that we can do from an interventional pain management standpoint to help address those pains. So my main job is to evaluate you in the clinic and see what I think is the primary cause, and correlate that with any simple imaging or advanced imaging, and of course, a very thorough physical examination to really decipher what is the problem. And then that way I can target it at the root cause. So what are some of your treatments, Dr. Haydel, that you tend to do for your patients?
Yeah, I want to bring up the point too, is that, a lot of folks out there in the past have been seen for their back and neck and been told, hey, there's nothing that there is out there that can be offered to help you. And I think that with the advances in surgical technology, there's actually a lot more that we've been able to offer our folks that we haven't in the past been able to offer them. My practice is focused mostly on minimally invasive options to treat spinal diseases. More recently, we have robotic technology that's allowing us to push the boundary of surgical accuracy as well as patient satisfaction and outcome. Newer procedures that are becoming more popular for people with chronic pain that may have had surgeries in the past. We have options such as spinal cord stimulation, where we've been able to help people with chronic pain that haven't been able to get any relief with any of these other options that are more conservative, and also things such as kyphoplasties to help patients with compression fractures, with chronic pain, and those types of things. So we offer a lot of these minimal options, but sometimes patients do need bigger corrections. They have scoliosis and curvature of the spine and difficulty with balance and not able to be as mobile as they'd like to be. And in that case, we were able to sit down and work with our team. You know, I work primarily in Baton Rouge where my practice is, but I coordinate with my colleagues in New Orleans, and we have a whole team of neurosurgeons where we collaborate as a group for these larger cases, and we're able to get a group consensus and to be able to plan these large procedures that can certainly be scary for patients. And when planned properly with the right patient, we're able to get great satisfaction, both with minimal options and with larger options as needed.
Great. So with this new back and spine center, the goal is to be able to route the patient to the appropriate care. So we've been working on this project for the last several months to make a lot of improvements so that we can help treat our patients with the best appropriate care possible. So if you're suffering from any type of back pain, neck pain, or any pain along the spine, you can certainly reach out to your primary care provider or even find some more information about the Back and Spine Center on Ochsner's website. Then you can just search for Ochsner Back and Spine. And we're based in Baton Rouge, but we have these services elsewhere throughout the Ochsner system. But we just want to make sure that our patients are getting routed to the appropriate person so we can help address their needs. So I want to thank Dr. Haydel and Dr. Derbigny for giving us all this great information. If y'all have any other questions, please look us up on Ochsner Baton Rouge Back and Spine, and we're looking forward to help address your chronic pain needs.